Morning, Matt. How are you?
Morning, sir. Just made you a co-host, so you should be all set to go.
Great, thank you.
No problem.
And it looks like we have some attendees on already.
Yes, sir.
Perfect.
Yeah, I'm going through there to make sure that panelists end up as panelists. If
Great.
you go through it too, that'd be good.
Can attendees hear us now?
Yes, very much.
Okay.
Can you hear me okay, Jeff?
Loud and clear. Good morning, Alicia.
Good morning. Good morning, Mono County IT.
Hello.
Is that Matt?
Yep.
Good morning.
Good morning.
Hi, Brianna.
Hi.
Good morning, Scott.
Good morning. How are you?
Good.
It's Friday, if that means anything for you.
I don't know if it does anymore.
I hear you.
No. Mm.
Good morning.
Morning, Lewis. Thanks for being here.
Good morning.
How's it going?
Hi there. Good morning.
Good morning, everyone.
All right, good morning, everyone, and welcome to the 9 a.m. Business Community Meeting. My name is Jeff Simpson. I work in the Mono County Tourism and Economic Development Department and will be moderating the meeting today. Our presenters this morning include Emergency Operations Center Director Chief Frank Freevault, Mono County Public Health Officer Dr. Tom Boo, Mono County Environmental Health Director Louis Molina, and Mono County Economic Development Director Alicia Venice. The focus of today's meeting will be to review the second draft version of the Mono County Business Guidelines that was distributed last night. If you've not seen that document, you can view it now by going to the Mono County Coronavirus portal and clicking on the Business tab, or using this URL link directly, monohealth.com/coronavirus/pages/businesses. This document was the result of many hours of collaboration with local stakeholders and members of the Emergency Operations Center Economic Branch. Many of those members are here today to answer your questions, including Scott Burgart, representing the Northern Mono Chamber, Brianna Brown, representing the Bridgeport Chamber, Claire Lindowski, representing the Lee Vining Chamber, Ralph Lockhart, representing the June Lake Chamber, and Brangle, representing the Mammoth Lakes Chamber, Brian Bolarski, representing Southern Mono County, Matt Jibo with Visit Mammoth, Town Manager Dan Haller, CAO Bob Lawton, Sandra Moberly with the Town of Mammoth Lakes, Christy Milovich with Mono County, and Kirsten Anderson with the Mono County Public Health Department. We will take your questions through the Q&A tab at the bottom of your screen at the end of the presentation, and then move on to phone questions before we wrap up the meeting. Please review existing questions in the Q&A chat box to cut down on duplicate questions. If you see an existing question that you want answered, please upvote it by clicking the thumbs up button next to the question so we can answer the most important issues. We will try to answer as many questions as possible before ending the meeting at 10:30. And with that, we'd like to pass it off to Chief Freevault to get the meeting started. Go ahead, Chief.
Thank you, Jeff. Welcome, everybody. Good morning. I'll try to make this as succinct as possible. There's a lot of ground to cover. So the first thing I want to cover, as you can see in your slides there, I'm not sure who's clicking away there. We'd move to the next item, I believe, number 3. Path to Recovery Overview. The Governor's Office has laid out a 4-stage plan. Essentially, Stage 1 is where we're at now. Stage 4 would be end of the COVID crisis. And so as of today, the governor's guidance is that we are entering Stage 2 in the low risk areas of Stage 2. The businesses allowed in Stage 2, I can cite examples here. It's best if anybody that is looking for direct answers, you go to the California COVID-19 website, and there's detailed information there about the various examples that are in. We were hoping to get something a little bit more definitive, but it's a good start. As of Monday as well, the governor issued another executive order that directed the state public health officer to create a process for counties to submit a request for variance. They recognize from the data that different counties have been affected different ways, and to recognize that, the public health office last night put out the variance requirements for Stage 2. What that would allow is the state governor's orders as it exists would allow a partial opening under Stage 2, not fully through Stage 2. If a county meets the requirements that are in the document that came out last night, then that county can submit an application for variance. If approved, that variance would allow the county to fully enter into Stage 2 activity economically and opening of businesses and venues, which would actually be ahead of the regular state orders. The guidelines obviously are under a lot of scrutiny, and I'm going to let Dr. Boo in a few minutes provide more exact information on that. He's been in touch closely with state public health on this matter daily, a lot of times, many times during the day. I know that he submitted an application for review. We don't have that. We don't have that back yet. But that is essentially the process that we're in correctly or currently. We're making every effort to request advancements into stage 2 based on our capacity. Last Friday, we turned in a document to essentially make that case. We felt that we were ready to do that. Now it's really a question of, will Mono County meet the criteria to qualify for variance? And again, when we get to Dr. Boo's portion, I'll let him provide the most recent information on that. The third thing I'll cover here is that, as we have mentioned for a little over a week now, we are preparing a portal for businesses to report in their readiness to meet the set of guidelines that eventually come out. We just got the state's guidelines for all sectors also last night, a little after 5. So while many of you have been working with Dr. Boo, and that's part of what we're meeting today, the state finally provided theirs across all sectors. That is also a link on that website, the roadmap for recovery. And in reviewing the orders that you have all been working on in conjunction with Dr. Boo and the ones that are on the website, I especially drilled down into hotels and retail. There's really nothing that's at variance between those two. If anything, I believe you'll find that Dr. Boo's orders provide a little bit more detail on how you might go about accomplishing some of the general requirements. And there's also an excellent FAQ document that was created by one of Dr. Boo's staffers to be as a resource for people to point down in. And, you know, if there's a question about how do you properly use gloves or how do you properly, you know, clean something, it's an excellent document for some links for quick examples. So just to review here real quick before I turn it over, we are entering the first part of stage 2 in a 4-stage process on the path to recovery underneath the governor's orders. If we have no other opportunity, we would enter into curbside retail, manufacturing that supports that, office work that can't be done remotely, and opening and access to some public places. And I have to admit that one's still a little bit vague for me in some of the descriptions. The governor's latest direction this week provided the announcement that we would do that today on the 8th. It also directed his health director to create a process for counties to submit an application for variance that would allow them to move all the way through stage 2 and not just limited to today's entry into the 4 items I just mentioned. However, that comes with qualifications that are outlined in the variance to stage 2 of California's roadmap to modify the stay-at-home order. That's also on the website that I cited. And to support that, we're building an online portal that would allow for self-reporting when businesses are allowed to open under their business sector type. And there will be a requirement for businesses to do so anyway. We just think this is a much faster, simpler, easier way to do it rather than have each person try to figure out what to write for their own business. So with that, I'll turn it over to our next presenter. Thank you.
Thank you, Chief. We'll move on to Dr. Boo, and I apologize. We're having trouble launching the PowerPoint right now, so we might just have to go through this view. Go ahead, Dr. Boo.
And I have, is Dr. Boo here?
Yes, I am. I was on as Alicia for a little while. We're having some technical difficulties. Good morning,
Welcome.
everyone. Tom Boo, Public Health Officer. Yeah, so thanks for bearing with us during this unprecedented and chaotic time and process. And you know, and so in preparation for more businesses being allowed to open, we've been working very hard to try to develop some guidelines that try to keep people safe, proprietors, staff, and customers in a situation where we don't really understand the enemy as well as we'd like, right? I mean, we just don't have enough science for some of this stuff. And then, and as Chief Riewald said, last night the state came out with some sector specific guidelines, and we've known that was probably going to happen, and so now we have to figure out, the things that we've been working on are in draft form. We have to figure out how to reconcile work with the state standards, and legally counties are allowed to have more stringent guidelines in the state, but not more lenient. In looking somewhat briefly, hurriedly through the state guidelines, my impression is that in many respects we are more stringent. So we may back off on some of the things that we are, have been thinking of would be required, and maybe make them recommendations, and perhaps the state guidelines would be the minimum standard, and perhaps the other things that we've thought about as best practices would be recommended but not mandated. So little bit of background there. I think we all need to think of such guidelines as being interim. This pandemic is a moving target as we do learn more about how long it survives, and on different services, and the relative risks of transmission, via droplet versus contact versus environment, and what practices work best to stop it. We need to. It's going to be a living document. We need to be conscious of trying to keep up with science, and keeping things updated, and as keep the level of onerousness, if that's a word, to a minimum, while still trying to maximize safety, and there's also this kind of whole promotional aspect to it, that if we are exercising and can tell the world that we're that we have best practices here, we think that there will be some some benefits economically. Our residents and our visitors will be more comfortable, more likely to come and recreate and do business in Mono County and Mammoth Lakes. Anyway, I think that's all I wanted to say for right now.
Thank you, Dr. Boo. Okay, we'll move on to Louis Molina with environmental health. Go ahead, Louis. Unmute you. There you go. It's perfect. Just unmute again.
Okay, I'm unmuted. Louis Molina with Mono County Environmental Health. Basically, I've been asked to answer a few questions here and go over some of these bullet points. And the main thing of this presentation, beyond the Q&A, is just to let people know that the whole idea of this business document is to, as Dr. Boo had already mentioned earlier, as it was in one of the other slides, this is really intended for the employees as well as the customers. So I want everybody to keep that in mind, that this guidance document is really intended to keep everybody safe. So that's where we're coming from on a lot of these recommendations as well as requirements. The items that I'll be covering really are some of the major issues that were brought up by businesses. So they had questions, comments about some of the draft guidance bullet points, if you will, or some of these statements that were out there that they wanted some better clarification. So I will touch upon those, but I think we'll have more opportunity to go into more depth into each one of those as we go through this presentation. I don't know if we can go to the next slide. Yeah, and this is just basically saying thank you for your feedback, because that feedback was really helpful in letting us know, we're going through all these documents, the scientific stuff, we're gathering as much research as we can when we're putting this document together. So by people responding, it gives us some feedback on, look at some things more closely, and to hopefully be able to respond to some of your concerns a little bit better as we put the document together. So thanks to all of you. We had 171 respondents. This, I'm not real familiar with this slide other than, but what I see from it is that the largest respondents, the community was the lodging community, followed by restaurants and general retail. And not surprisingly, most of those comments came from Mammoth Lakes, just basically that's where the majority of these businesses reside. So, but we did have responses from, it looks like every, major part of the county, or every part of the county, we had some amount of response from there. So yeah, addressing the major concerns. And I think I don't have this one here, but just so you know, this document at any time could be superseded by any state guidance or requirements. So this is a draft. As Dr. Boo mentioned, these requirements are, and the science on them is a moving target. As we know more about this, and as the state and the federal government knows more about it, it will morph, and we will change this document or update it as necessary so that we are up to date with the guidance and with the most latest scientific criteria that we should be following. So some of the issues that were brought up, and some of the major issues that were brought up in comments that came from around the county, was in the lodging industry. And one of the greatest concerns was this 24-hour window between bookings. So this is a recommendation. If you can go longer than that, it's recommended. I think the California Hotel and Lodging Association recommends anywhere from 24 hours to 72 hours that the room remain vacant before it is even cleaned. That's just to allow inactivation of the virus. So depending on what type of surface the virus could be on, it takes a certain amount of time for that virus to inactivate. So for the safety, primarily for the safety of the staff, the housekeeping staff, we recommend that you maintain or that you implement a 24-hour window before going in there and cleaning that room, and longer if you can. We realize there's going to be some larger establishments that maybe have enough rooms. You might be able to rotate enough rooms in and out that you could go 24 hours or longer and meet your demand, where we also realize the smaller establishments, it's just not going to be viable. You're not going to be able to do your business, under that criteria. So we realize that, and there are more stringent requirements. If you need to go in there and you need to book that room, the next day or the same day that somebody vacates it, then the primary difference is going to be that your staff are going to have to wear a higher level of PPE, primarily an N95, maybe some garments that they can remove and either discard, or washable garments that they don't carry home with them. We just want to make sure that they're not infecting others after they do that work. And of course, in both cases, they're going to be wearing gloves. The other thing is the laundering of bedding. There was a lot of feedback, concerns about requiring all bedding to be laundered. And, I think, people can realize that that's a very high contact area, right? I mean, people are in close contact with their pillows, with their, with all the bedding. And so we felt that is an area that really should be washed, should be laundered after every use. I think normal industry standard is maybe some of the bedspreads don't get laundered every time you are laundering, obviously sheets and pillowcases. So we go into some detail on that, but the recommendation is that all fabrics, all of the textile fabrics and the bedding be laundered after each guest. We'll go into some more detail on that, but what that might mean is if you don't have the means, or it's just impractical to be laundering a bedspread per se, there are other things you can do, such as maybe having a duvet and duvet cover where you're going to strip the duvet cover off, and you can launder those as you would your sheets. So there are some things that can be implemented. The other thing that we wanted to mention was that extra bedding, meaning, extra pillows, blankets, often found in closets of hotels. we recommend that you take those out and just offer those upon request, because you may not know if somebody used those, and it would basically require that you launder those after each guest leaves the room as well. We also go into in the FAQ, as well as in the guidance document, some information on pool and spa use. Our recommendation from the health department is that the pools and spas should be closed. That's the recommendation. Again, it's not a requirement, but it is a high contact area that's hard to keep people separated. So that's really where we're coming from. If you are going to open that jacuzzi or that pool for use, we have some guidelines that you should follow when you put those into use. Next slide, please. Restaurants. One of the things that came up was, and rightfully so, we're limiting the number of seats just basically by spatial separation in all businesses, including restaurants. It just is going to limit the number of people you get into a dining room. We're trying to keep that 6-foot separation. So, folks were bringing up the idea of where they're maybe not even already doing it, is putting some outside seating out there to allow for more customers to be seated. And from the environmental health standpoint, we have no problem with that. It's allowable now under certain conditions. Obviously, we want to maintain certain sanitary requirements and other requirements that we would normally be looking for in the food code. But one thing to keep in mind is that moving chairs outside, you may be infringing upon some right-of-way issues, maybe some parking issues, other things like that may be prohibited, or there may be some restrictions, or you may need to go through some other review and approval process through the town planning department or the county planning department, depending on where your facility is located. So keep that in mind. From our standpoint, public health, it's not a problem, but make sure that you bounce that proposal off of all applicable government agencies, primarily the planners. Face coverings, people had a lot of questions and concerns and feedback on that. It's required of all employees. And just keep in mind that it's not just, we're not requiring face coverings just for the people who are interacting with the public. It's to protect employee from employee. Keep in mind that lots of people are asymptomatic and they could be shedding viruses. So that's something we really want to make sure that employees in the kitchen are using face coverings really to protect each other. Guests do not have to wear face coverings when they're eating and drinking. They should be wearing them when they come into the dining room, and then once they're seated, they would remove them. And another consideration is to limit your larger tables to 6 people, to guests of 6 or less. You can obviously take reservations from larger groups. We recommend that you break them up into a couple of tables. And again, that's just to help minimize close contact between the people at that table as well as people around them. Next slide, please. Retail in general. We have a lot of information in the FAQ document on spatial distancing. So I just encourage everybody to go through that frequently asked questions document, as well as the guidance document. And we go into a lot more detail of how you can maintain and monitor for that 6-foot separation in every type of business. For businesses where equipment is rented, equipment that can be thoroughly disinfected or cleaned should be rented. For now, until we get a handle on this virus, or until we can put this virus away in our past, you may want to just think of taking some of those things that are just hard to maintain, hard to assure that you've cleaned, disinfected properly. Just take them off your inventory for rental for now. That would be the recommendation. Strategies for promoting contact businesses or contactless business practices are found in the FAQ. That's the point of service areas where people have to either swipe their cards or touch screen information when they're doing their purchase. if you can minimize any kind of contact to surfaces, we go into more detail, perhaps having people call in ahead of time, give their credit card information, their payment information, anything that you can do to minimize or eliminate people touching things in your business is what we're trying to promote here. And as of now, any large gatherings and including weddings, they are not permitted. They're still prohibited by state law and by our local ordinance or our local order as well. As of now, there is no determination of when we'll get to that phase, but as is, fairly obvious, large gatherings are a huge potential for spreading of infection among the people. So it's just, they're out for now. And then just some points on all businesses that I've discussed, as well as any other businesses not discussed. The Joint Information Center is working on consistent signage. So at some point, it may already be out there. I'm just not part of that process. We will have that available online that maybe you can just go ahead and download and print. Some businesses were asking, what kind of wording should we have out there? And certainly you can use your own, but it would be helpful, I think, to have some consistent wording and signage out there, maybe with a logo of the county on there, so it doesn't all fall back on the business owner to have to be saying, hey, this is our requirement. You can drop some of the requirement on us by using our signage. Businesses are not required to enforce wearing masks or maintaining distance. Your face coverings or just not adhering to distancing. So if I would certainly recommend that you recommend to these folks when they come in that they either put their mask on or they please maintain their distancing. But if they become belligerent or anything along those lines, we don't expect you to be enforcing that. If they become disruptive, then there's always law enforcement that you can consider. Professional offices are also included in the guidelines. That's just general office space, like where I'm sitting right now. The county offices, when we do get back to the offices altogether, we're going to be required to wear face coverings just in our general areas where we're commingling. At our own office where we're alone, or in a cubicle, that won't be necessary. And we go into some of those some of that guidance of where you should be wearing face covering, as well as disinfecting a lot of the high touch areas. So a lot of the more relevant business information you can find on the FAQ document, as well as screening employees, and there's a lot more information that you can read on those documents. So we will entertain questions at this point, but I encourage, if you haven't already done so, please review the business document and the FAQ, because more than likely we go into the detail of the question that you're asking. So that's all I have right now.
Thanks so much, Louis. So it's 9:30 right now. We have a full hour for Q&A, and we'll try to get to as many questions as possible. But if we're not able to answer your question, or you'd rather just email us, we've set up this email here, covid19help@mono.ca.gov. You're welcome to email that if you can't find your answers in the FAQ document. So with that, we'll go to the Q&A. And again, if you have a question, just scroll over at the bottom of your screen and hit the Q&A tab and submit a question. And please just look through the existing questions so we don't have duplicates. If you see something you'd like answered, just hit the thumbs up so it will move to the top of the screen based on popularity. So with the first question, and this is the million-dollar question, will there be a firm date on when short-term rental restrictions will be lifted? Who would like to take that? Dr. Boo or Chief Freewalt?
Sure. I can. This is Tambu. No, that's coming from the state, and we don't have any clear sense of when we or any jurisdiction will be allowed to move into stage 3. I mean, all the focus so far has been into whether or not to move into stage 2 in a more full way, and we've not had any guidance or information about stage 3.
Okay, next question that is not related to timing. At what stage will homeowners of second properties be allowed to come to Mammoth? Refurbishing and prepping for winter happens in the summer.
I can take that one, Jeff. Second homeowners, the only restriction that second homeowners have ever had was this concept of non-essential travel. The general idea was, obviously it's their private property. What the order was intended to do is to keep people from bouncing back and forth from multiple residences. Obviously, that's a way to spread the virus. But people with second homes here, to the best of my knowledge, were actually never deterred from their own property. The only consideration would have been, was it non-essential travel? Ideally, once you get to a spot, try to stay there.
Great. At what, let's see here. When will the Sierra Star Golf Course be opened? Is there an estimated date or time frame? Golf courses are being opened all throughout California at this time.
To the best of my knowledge on that one, the issue wasn't the golfing itself. It sounded like the restriction was actually on the ability to do maintenance on those. I know I had a question, I think, from may have been John Morris about the driving range, and I don't think there's a lot of maintenance there. That strikes me as one of those examples under loosening of public spaces. When I went through the documents last night and this morning, I didn't see anything specific on the driving ranges. So the golf courses specifically, I don't know that it's the golf courses being closed as much it was at that time they were calling it non-essential work for groundskeeping. Dan, you have more information on that.
Yeah, if I may, this is Dan Haller, going through the governance stuff. One of the elements in there for exercising that was listed as something that was appropriate to be doing was golfing, single people, single cart type usage. And so if they are saying, I'll say they being the governor's office, calling that out as a eligible type of exercise from our perspective, is that would mean that you would have to have those things available to be able to do that, thereby allowing that operation of the golf course to proceed. I do think it fits under the stage 2 elements as well. The landscaping, gardening question has come up a few times. We have had the discussion with the golf courses in terms of just kind of a safety element of getting out and making sure that water systems are working properly so we're not wasting water resources. We do not want to see the asset of a golf course lost. Therefore, you need to maintain it appropriately to ensure that asset. If there's other hazards and other elements with the golf course, that they need to address that as well from a safety perspective. And so I believe, under those various areas that the golf courses could be up and operating within some restrictions by the holiday this month. And then it would be a business decision by the golf courses, naturally, if that makes sense for them to be up and running, pending the level of visitors that we have or do not have within the community.
Great, thank you, Dan. Next question. I've developed an operations plan to run my guide service safely. I'd like someone to review it and advise. Who might help me with that review and advice?
Hey, this is Tom Boo. Yeah, I'd be happy to and appreciate the work on that. I mean, we're we're aware that there are sectors in the Eastern Sierra that will not be addressed by any state guidelines, and recognize that many times the people that do the work have the best ideas, the best insight into where risks exist and how they can be mitigated. So yeah, please email that to either me at tboo@mono.ca.gov or to anybody who from whom you got the information about this call, and they can share it with me.
Thank you, Dr. Boo. Okay, next question. When can we get specific guidelines on gatherings? We are entering the season of barbecues, outdoor sports, weddings, etc. How many people can gather at one time outdoors legally? 10, 20, groups of 120?
Okay, hey, this is Dr. Boo again. Again, that's in the hands of the state. The governor and the state health officer. Gatherings are considered a stage 3 activity, and we're just today beginning to creep into stage 2. So do not really have any meaningful insight for you there. And I'm sorry, I know it's a huge issue, but no gatherings of any kind are permitted during stage 2.
Thank you. Let's see, if the county variance gets approved, that will not provide businesses much more than dine-in restaurants and relaxed retail shopping. But we need lodging to bring visitors. Are we going to ask the state to move through stage 3 so we can open campgrounds, short-term rentals, and hotels?
As incident commanders in EOC, I don't think it's our intention to ask the state to rush that. Our elected leaders may choose to make that request. But the concept is that every time from the federal guidelines to the state, to what makes sense to us here locally. What we want to say is that every time that we take a step, make some modifications, to the current very stringent distancing, stay-at-home approach, that allow some time to monitor. First there's a change in policy, and then people's behavior change, and then transmission of the virus changes, and exactly how long that period should be is a little bit unclear. But to me, it makes sense that should probably be about 4 weeks at minimum. To see whether with each change that we make, whether we're starting to see more transmission, and recognize that, when we talk about these variances and things, as Chief Freewalt said, the state expects that we have very low levels of virus transmission. I mean, one case per 10,000 people over 14 days is one of the current standards, which we frankly can't quite meet right now. And we're going to have a discussion with the state about that. But as we monitor the number of cases, the percentage of tests that are positive, the number of people calling with illness to the nurses, hotline that we're, sending for testing, the number of people with COVID-19 in the hospital, all these things. If we see that things are going the wrong way, we have to back off, and we don't want to have to do that. So, it's this very difficult, challenging thing where, it's even worse to have to take 2 steps back. So we think that if we take baby steps forward, that's the best thing in the long run. But I know that's not a satisfying answer for many people.
Jeff, can I add something here?
Yeah, please go ahead.
So we're answering questions, and I feel it's a little bit piecemeal as the questions come across. So I'm going to take a leap of faith here and try to knit together, I think, an answer that really kind of what we're looking for, big picture, which is, we all know that short-term rental is the key to any significant business activity. We could open up all kinds of things, and if nobody's here, we're not going to sustain ourselves on local business only. We know that. So when we're looking at this, I generally try to think about it and approach it from there's kind of 3 lanes that we're working in parallel, and they need to stay connected, but they are distinct. And so one of the lanes is the public health lane. And I can tell you that in that lane, we are pushing the bumper of our county into the back of the governor about as hard as we can. Well, in fact, it's exactly as hard as we can. We issued an unsolicited description of our readiness to enter into the next stage before it was asked for. So we took initiative there. As soon as the form became available, I saw Dr. Boo shoot one off. I see also from email traffic that within the last 10 minutes or so, he's been invited to entertain the next phase of that. We don't know what the outcome will be, but I can tell you that at every turn, Dr. Boo has been representing our county at the front of the line for every step that we could take there. Also, if there's any questions about, well, gosh, I think other people are getting ahead of us, they're just sort of disregarding the order, kind of a damn the torpedoes approach. I have in front of me a copy of a letter to a county from state OES, making it very clear that they recognize that that county has issued orders in contradiction to the governor's orders. The clear language in the letter is such that if you're doing that, you clearly must not have an emergency, and therefore your federal and state funding that you've already received could be in jeopardy for forfeiture, if I understand the letter correctly. Also in the governor's press conference yesterday, he's usually fairly mild-mannered, but he made no mistake. I ran the recording back several times to make sure I understood him. So there's people decide to get out ahead of the stages that he announces or the variance process, that they will be compelled to enforce the guidelines. I think there's only so many ways to interpret that. Compelled to enforce seems pretty clear to me. So I know that everybody wants a date. They want to feel like we're swinging the bat as hard as we can at the state level. I believe we're doing that. If we push it too hard, we can find ourselves on the short end of the stick with maybe some state and federal funds that we could qualify for in the future or may have already received. And that's not good. So that's kind of the public health lane. The business opening lane is where we're going to try to work as closely as we can to make these onerous and devastating requirements from an economic standpoint as least obtrusive as possible. And I believe Dr. Boo has committed to that in spades over the last few weeks, as have many of you that are on this call. You had many interactions with them. I think we're on our third draft of those requirements. When you review those requirements against the ones that just came from the state yesterday, our time was not wasted there. It was clear that we're right in line and occasionally provide a little bit more guidance that you may need when we go down there. But as Dr. Boo just said, we won't make it any more onerous than is required. The third lane is the political lane, and this is where we would expect our elected bodies to take that route, as opposed to us trying to push from the public health side against the rules that are laid down. So as we're answering the questions and we're going through the process, we know that all those have to fit together, and we're doing our darndest to get there as fast as we can without doing two things. We don't want to devastate the economy any more than it already has been, and it has been crushing. That was part of the governor's response yesterday. State of California's economy's been devastated. But we also don't want a resurgence that we cannot handle. We do expect more uptick in activity. We built the capacity to deal with that, and it's been based on all of you leaning hard into the things we've asked you to do that are completely abnormal. But the only thing worse than the condition we're in right now is to have to go back and do it all over again. Thank you.
Great, thank you, Chief. Let's do two more questions on the Q&A, and then it looks like we have two phone-in questions, and we'll get to you after that. So John Morris and Edith, please stand by on the phone. Next question. There have been many different dates thrown around for fishing opener, May 15th, May 20th, and June 1st. Where are they getting this info, and what is the reality of the situation?
Hey, this is Tom Boogan. As far as I know, it's June 1st. I mean, the Inyo and Mono counties, and maybe Alpine County too, I don't know, sent letters to the state Fish and Wildlife Department and Commission requesting that the original April fishing opener be postponed for a month. And so it's either May 31st or June 1st. I don't remember which. The supervisors were talking on the other day at the meeting, the county supervisors, about the possibility of sending another letter to the state asking them to move it again. But I don't know if they, I know they have not taken any action yet. I don't know if they intend to make the request, but my understanding is that INYO is not interested in supporting that request. So anyway, right now it stands at the end of May.
Yeah, thank you, Doctor. May 31st is when the order expires, so June 1st would be opening day unless it is requested to be shortened or extended. And again, both Mono, Inyo, and Alpine counties are in the same boat with that order. Okay, there are a lot of questions about a laundry, so I'm going to try and group them all together with one question. If you wait 72 hours, do you have to wash comforters or blankets? Is there a disinfectant that could be used instead? Louis, that
I'll take part of it, and then there may be a couple of other panelists that can pick up more detail after that. In reviewing the guidance that came out yesterday, I believe it's I forget the name of the association, but I believe it's the California Hotel, I'm sure I'm getting this wrong, association. You know, they had a set of recommendations that had this time component to it as well. There's also on the website, though, the state website, there's a link to EPA approved kind of cleaning solutions and disinfectants. Also, Dr. Boo's guidance has some on there. So from the cleaning standpoint, there are some recommendations out there on what you can use from a disinfectant standpoint. I'm going to step back now on the timing issue and see if maybe Dr. Boo or possibly Louis can weigh in on that.
Louis, you want to take a first shot? But Jeff, could you restate the question, please?
Yes, 1 second. If you wait 72 hours, do you have to wash comforters or blankets? Is there a disinfectant that could be used instead?
It's a good question, and I don't know that we have the science. You know, and the 24 to 72 hour recommendation is before you clean the room. Would the virus die on the bedding? Don't know. I would certainly recommend that you know, I mean, probably just get rid of the things that are so difficult to launder and you know, again, I have to look at the new state guidelines and see, you know what's a shall and what's a should and what's a requirement, what's a recommendation. But I would definitely recommend that everybody launder all bedding between guests, you know, at high temperature CDC recommends. Louis, do you have any?
I would recommend the same. You know, I'm just looking at the because you know I don't have this committed to memory, but I'm looking at the frequently asked questions, and there is, you know, what I think the first one is, how long does the virus live on different surfaces? And you know, again, this is not this science is changing all the time. So I don't know how solid this is, but it does mention that on cloth that the virus can live up to 2 days. So, you know, how did they determine that? Was it in a laboratory? Was it in a hotel room? Likely not. So we would always recommend you err on the side of safety, and I would recommend that you launder all these materials, all the bedding between guest uses. You know, I think that's the best we can say. So that would be the recommendation, because we just don't know. The science isn't out there. The studies haven't been done in all situations. We do know that the virus is going to survive. It's going to be viable for a period of time on different surfaces, including the bedding. Now, you know, if you wait 3 days, would the bedding be, or would the virus be inactive? I don't know, but would it be inactivated on top of the comforter? Would it be inactivated beneath it? Would it, you know, so I mean, there's all these questions that we just don't know. So I think, again, on the side of safety, yeah, absolutely. The recommendation is that you continue to wash all the bedding between guests.
And I'm sorry, thank you, Louis. But there was another part of that question about whether there's a disinfectant that could be used. I gather that was related to bedding. I honestly do not know. I mean, I would have some concerns about, people having, contact hypersensitivities or allergies to, to disinfectants used on bedding, but I just don't know, what's out there for what purposes well enough to answer that with confidence.
Hi, everybody. It's Alicia here with Economic Development. I just wanted to add and maybe invite Matt Gibo from Mammoth Lakes Tourism to step into the conversation for just a minute. We know that when visitors return, and I'm sure that many of you on the call today and the meeting today have heard this research for visitor intentions for travel, and we know that the number one concern that they have is cleanliness and hygiene at the establishments that they want to return to or visit, so or stay at. So it's such a tough balance, but the cost of laundering, things that, bulky items is challenging. But I think that and I know most of you are already doing this, but we really need to focus also on reassuring the guests that where they're staying, is excessively clean. And I don't know, Matt, if you're here, if you'd like to just share the statistics on from your visitor survey.
Happy to, but maybe give me a minute to pull that up. I don't have it in front of me, but it's anecdotally what I can tell the folks on the call here is that the number one deterrent for people who said that they were maybe unlikely to travel, and we did get about 2,000 respondents on the survey that we sent out. The number one deterrent was being assured of cleanliness and of lodging and nightly rentals. And then again, anecdotally, the number one comments we received from folks when we asked, what are the reasons you are less likely to travel, was exactly that, just being assured of cleanliness. So I can pull up more solid statistics of what we got from respondents. And again, that is also available on our industry site, that the full study. So anybody who wants to have access to it can get access to it. And people are welcome to reach out to me at mgibo@visitmammoth.com if they want to just have a copy sent to them versus trying to find it on the industry site. So thanks.
Thank you, Matt. Okay, let's move to some of the phone calls. Let's see, we have 3 people in queue here. So I will ask Edith to speak. Edith, if you could hit *6 to unmute yourself and ask your question, please. Edith, if you could hit *6 to unmute, and then you could ask your question. Okay, let's put Edith on hold and we'll queue up John Morris. John, if you want to hit *6 to unmute, you can ask your question.
Okay, I just unmuted on my, thanks. Thanks everybody. So I will try to make this as quick as possible, but I want to emphasize on behalf of the Mammoth Lakes Lodging Association how incredibly difficult the laundry aspect of this is, not just from the standpoint of the individual businesses, but overwhelming our one laundry service that we have in town. I'm hoping that Mono County Health will continue to work with us on maybe possibly some other solutions. The idea of laundering everything that sits on a bed every time, not only from the cost standpoint of laundering those items, but the durability of the types of items that we launder, the cost of purchasing those items, the amount of items that would need to be purchased in order to be able to accomplish that, and the cost involved there. It's astronomical, and either that's going to have to be passed on to a guest in the form of greatly increased fees, Or the other thing that it may force many of us into, including me at Snow Creek, is simply not offering any bedding to a guest and saying, it's basically, you got a nice condo, but it's like camping. You'll come up, you'll have sheets and pillowcases and so forth, but no blankets, no bedspreads, nothing. We really don't want to do that because that greatly diminishes the guest experience. I completely understand the health aspect of this, but I'm just hoping that some of the other things that are possible that have come from the Vacation Rental Managers Association's recommendations, like triple sheeting, which to me seems about the same thing as you have a pillowcase, you take the pillowcase off, there's nothing in the guidelines, and I've read them over and over and over again, that says that you must have a pillow case covering, or that you must sanitize a pillow between stays. So if that's allowable, I'm not quite sure why maybe triple sheeting wouldn't be, with some sort of sanitization of a comforter or so forth. So I'm looking for some more guidance, because I think what's going to wind up happening here is either people aren't going to they're not going to conform with the guidelines because they're just cost prohibitive, or the availability of being able to purchase items is going to be difficult because everybody will be looking for these things at one time. Yeah. Or we have to so greatly change the way that we do things that guests perhaps won't want to come to stay in a place where they don't get any bedding. So I appreciate all the work that's been done. I get it, but I'm still looking for, and all of us are still sort of looking for, a little bit more middle ground on how we might be able to accomplish reasonable amount of safety and health without not being able to operate. So that's my point. Thank you.
John, just a quick question. Can you elaborate on what is triple sheeting? I don't know what that is. How do you implement that? What does it look like?
Sure. Thank you. So triple sheeting basically is you have a fitted sheet and then a flat sheet, and then you have a warm layer, either a comforter, duvet, whatever it may be. Then you have another sheet on top of that, which gets tucked into that. So yeah, a lot of hotels use that as a protective layer over the top of their comforter. Is it foolproof for a person not to come in contact with the comforter? No, it's not foolproof. But we're hopeful that perhaps, and I know Dr. Boo alluded to the fact that he's unsure about disinfecting a comforter / duvet at this point, but I was hoping that perhaps there could be some more information out there about how you could potentially spray that comforter in between stays and wash it periodically, rather than having to wash it every time, by using triple sheeting. That it is in the guidelines of, again, the Vacation Rental Managers Association, which I know is not a California association, it's national, and it's not a medical group, but that's kind of our national organization. So that's what triple sheeting is.
Well, thank you. That explains it. And yeah, I mean, we definitely want to look at those guidance documents and incorporate them as much as we can. And just, anecdotally, just thinking of triple sheeting, to me, it sounds like a duvet and a duvet cover sort of situation. So, which we've already said would be okay to just wash the duvet cover. So yeah, we'll look at these recommendations. We appreciate any ideas that you can throw out there. And if we can have a certain level of comfort with them for safety, then absolutely, we'll consider those. But thank you.
Yeah, and again, John and others, Tom Boo here again. Thank you, Louis, for that. Again, when we were drafting these things and bouncing them off, some of y'all in the business community, we were waiting for the state to develop their own guidelines, and now the state has put out some guidelines, and as I said earlier, I want to take a closer look and try to reconcile those, and maybe in issues like this, it makes sense to accept the state standards as the mandatory, the requirement, and other things perhaps could be recommendations. I mean, there was some talk about people would so one thing that we haven't really talked about is that I think the state intends to require each business to submit a plan for how they're going to enact, adopt, comply with safety standards, and we have hoped that this concept of a website a county website, that each business owner can go to and kind of, attest to or check off that, that they're doing certain things. But there's been a bit of a concept that maybe there'd be sort of a minimum level and then a higher level, and perhaps anybody who attests that they're meeting the the state standards can operate legally, but then other people who are able to do more, maybe they could get a higher level county certificate or something like that. But it's all kind of ideas at this point. So.
John, this is Frank. First of all, thanks for bringing the example. It's exactly the kind of thing that we're looking for in the process. People closest to the work are going to understand their job better and how we can kind of meet the intent. So I agree with Lewis. It sounds very similar to a duvet cover situation. One of the things I said that we kind of got 3 lanes we're working here, right? There's this public health lane and then this business lane too. I know I've been looking at some of the, I guess what I would call our competitor counties and kind of looking on their websites and, picking up ideas, not just from the EOC side, but also on the business, resumption side. And I think, that's going to be another element for us to be successful. Is it's not just going to be what meets the minimum public health requirement that we come up with, but it'll also be, on a kind of a countywide setting, how do we stack up competitively with the best practices of the other places? And so I know looking at a few of those, people are wrestling with this. I think this is the first time I've heard this particular example that sounds like it would meet a couple of criteria. So that's the kind of thing that I know we're looking for in meeting the intent of the public health orders to keep people safe, but find a way that it's not so onerous that it just can't be accomplished. So really appreciate the example. And if that's not already worked its way back into the guidelines, let's make sure we capture that. Thank you, John.
Yeah, and again, if there are disinfectants that are marketed and there's some recommendation, some validation for their use for bedding, then yeah, I think everybody's open to looking at all those options.
Okay, we're going to keep moving here. We have about 80 questions and less than half an hour left, so we'll keep moving. I've been told that the U.S. Forest Service is taking reservations for campgrounds starting June 1st. How does this fit with the Stage 2 plans?
I'm on meetings twice a week.
I'm not sure how it fits with this meeting, but go ahead, Frank.
Oh, I'm sorry. What I can tell you is that the federal campgrounds are on a restriction until May 5th. They could potentially be lifted at any time, but the current order stays until the 15th. But it seems unlikely that people would actually have a reservation for the 1st of June because each of the HTF, INF, and the Bureau of Land Management, I speak with them twice, so actually 3 times a week. As of yesterday, they said that they're not bringing on their concessionaires until June 1, and that the concessionaires then need at least 2 weeks to finish going through their opening processes. So if people have a reservation for June 1, I don't know how to square that with what I'm getting directly from our federal partners and their concessionaires.
Yeah, thanks, Frank. And so Tom Blue again here. So basically, I don't think opening campgrounds really does fit very well. It's not very compatible with the state of California's Stage 2 of stay at home. But the federal government is it's a separate entity, and I know that the local forest supervisor and the regional forester for California, Randy Moore, have been trying to be very supportive of the governor and the state's efforts. I mean, the Humboldt Toyabes, managed separately out of a district in Utah. But there could also be, other directives and pressures from Washington. So I really have, no insight into, where they're going to go, whether they're going to extend campsite closures developed rec closures beyond the 15th or not.
Okay, next question. The state posted that stage 2 includes hotels and lodging. Why is the county stating that is stage 3?
I think if you read that more carefully, I mean, lodging has been allowable from the very beginning of stay at home for essential purposes, and that does not change in stage 2. Lodging is still not allowed for recreational or non-essential travel.
What level of new infections will trigger a second lockdown?
It's a great question, and we're still trying to work on our local criteria. Certainly there's concepts out there that if the hospital has 5 admitted patients with COVID-19, lights will be blinking on that. But there's some things that are you've all probably heard about contact tracing, right? I mean, it's a very fundamental, old-fashioned core public health concept and practice where, in communicable disease, if you identify somebody who has a disease that they can transmit to others, we need to isolate the person who is sick and talk to that person and talk to their family members and figure out who they might have exposed, where they've been, who they've been around. And then you assess the health and well-being of the contacts, and if you determine that there was a risky exposure, in this case, you would quarantine those people for 14 days. And so right now, I think we have in Mono County Health Department, I think we have exemplary contact tracing capacity. I mean, we have a good number of solid people who are ready to jump on top of the cases that appear. But when we feel like our contact tracing team, and even with the reserves that we can call up from other departments, we're having some conversations, some discussions about this week about training up some other people to be kind of in reserve and on standby if we need them. But if we're realizing that over a course of not just a bad day, but over the course of several days that we're not able to keep track of, monitor, identify, communicate with, quarantine the people that we need to, that would be a huge red flag for me. We need to be going backwards.
Okay, I see a lot of great questions on here. Some of the questions that are posted can be answered in our FAQ business document. If you haven't seen that, you can go to monohealth.com/coronavirus and click on the business tab. There you'll see the latest draft business guidance document and the FAQ. And again, if we don't get to your question here online, we also have an email set up, covid19help@mono.ca.gov, and we'll try to get to as many as we can here in the next 20 minutes. A lot of questions about PPE. Where can we buy N95 masks and other PPE equipment? Do we have any available within our communities or through our government to access?
I'll take that one, Jeff. Yes, Unified Commanders about a week and a half ago committed to making sure that we could provide some starter. It's not going to be enough for people to sustain. They'll have to eventually start picking up their own stuff. But 2 things we could recognize early on were going to be hand sanitizer and masks. So we made a request into our local distilleries. We know it's a reliable logistics chain for 200 gallons on initial run. They can't do that all at once. It takes them a little while to do it, but we're using both of those. And so we have secured that to begin with, and we're picking up some materials to do distribution down to a certain point, and then we'll be looking to the businesses themselves to have end user containers. And the second thing has been masks. So we have about 20,000 masks that we can redirect out of inventory currently. And so that the commitment's already been made. It's just about the process of deciding, distribution and timing. And we also wanted to wait until we got the guidelines that just came out late yesterday afternoon, because we thought that might influence it. And then we're also willing to share the logistical ordering points that we used when and if businesses want to do some of that themselves. We also could consider, maybe doing some resupply, but I don't want to get too far ahead of those initial commitments without getting back with Dan and Bob.
Yeah, thanks, Frank and Tom Boo again. If I could just add, so when we were discussing these issues a couple of days ago, Kirsten Anderson, who's our public health temporary emergency hire, who I want to give credit for the great frequently asked questions document. She's a public health graduate student at Columbia who's been furloughed, but anyway, she quickly Googled N95 sources and said that Home Depot, for example, seems to have plenty of varieties for sale. So there have been nationwide shortages, but I think those shortages are decreasing. I think the market is going to be able to supply most needs going forward. But yeah, we'll see, and we'll try to augment where we can and where we have to.
I would advise starting your ordering early.
Great, and I'll add to that, please work through your local chambers of commerce. I know Brianna Brown in Bridgeport has purchased a lot as well. I know they have links to suppliers, including things like fogging machines. So there are a lot of resources. Please just reach out. Okay, next question is in regards, there's a few of these out here, so we'll try to answer all of them within this one question about reservations. When can we start taking reservations? Is it June 1st? Can we take reservations early in hopes of an earlier opening, or do we need to wait until after June 1st to take reservations at this point?
Dan, do you want to take that one?
There we go. Thank you. Yes. We do have a current order on the lodging elements and of that nature that would be our order kind of banning that is tied to the fact that the essential workforce is not supposed to be servicing the lodging properties. Our order ends end of the month, the 31st. Whether or not that will open up any availability to take reservations in June is still up in the air, as the governor's order still prohibits that non-essential travel, and also the worker support for that is not necessarily considered essential either in the current list of essential services. So that's a little bit of a problematic issue in terms of reservations being taken at this point. One question the other day came up is, if people are traveling outside of California into California, how does that apply to the governor's order for non-essential travel? Kind of a huge question mark. Also, what happens there in terms of being able to service them from a worker standpoint. The other side of that is looking, I think the question came up earlier on campgrounds. It sounds like the Inyo National Forest is looking at the potential of opening their campgrounds June 1st based on a statement that came out, I think just today or yesterday. I have not tracked down the final document there to make sure that's what it was. There's also some campgrounds that frankly, you really can't lock up, if you will, or lock people out of. So some of that opportunity for people who are driving through and have a place to stay. The question there is just being able to provide restroom services and trash services, and town and county will be looking at some options to be able to support some level of that from a health and safety perspective. We do not want, fires started, or we don't want a lot of human feces, if you will, out around campgrounds. It just creates a whole nother health hazard for us. So not a hard answer yet on that for opening up, but pushing hard on that. The lodging hotel elements are called out in the governor's phase 3, which we don't have a solid timeline on when that will be available.
Thank you, Dan. So we have 15 minutes left. We'll keep moving.
Jeff, this is Brian Belarski. Can I go back to that last question, please?
Sure, Brian, go ahead.
So if I understood the question correctly, it was whether or not businesses that are in the hotel, motel, rental business could be taking reservations. Was that the question?
Yes.
Yeah.
Okay.
So if
Certainly, most today you don't need to be in the office to take reservations. Booking.com, online reservations. So my recommendation would be basically on the consumer side, buyer beware, and on the business side, buyer beware. There's no prohibition on taking a reservation in the future. And certainly on Convict, we're getting quite a few, but you may not be able to honor that reservation because you're prohibited from having a short-term rental. So I just wanted to clarify that point. I know we have that issue here, and we're having to deal with guests that actually had reservations already on the books for June and beyond, and we're giving them the best information we have. Certainly all of our reservations up till June 1 have been canceled or rescheduled, but after that point, we're going to have to deal with it as the situation changes, and whether or not any business such as ours can have rentals will have to be determined at that time.
Correct.
Okay.
Thanks, Brian, for that input.
Yeah.
Okay, we have another timing question. So I'm not sure if it can be answered 100%, but there are a lot of them around this issue. When do you expect dining in-house to reopen? We need to get employees back in place before that. We have a timeline on in-restaurant dining.
Yeah, hi, Tom Boo. We hope we can make that happen soon. Again, the governor, the state health officer, in allowing the very limited curbside retail today as sort of a first step into stage 2 has given local jurisdictions like counties the possibility of testing that they're ready to more fully embrace stage 2, which would be basically more normal retail and in room or outdoor dining with spacing. And we don't quite technically meet the eligibility requirements of the state that were shared yesterday to seek a variance and for me to attest that we're ready. But we feel, I mean, collectively as unified command and incident commanders, that our curve is probably about as flat as it's going to be, and I'm willing to attest, but we have to argue our case. I think. I mean, in between questions on this call, I've been having some little email exchanges with the state health department, trying to schedule a conference call to talk about Mono County situation, and if they don't give us hard stops, on our eligibility, then I think we're prepared to attest within the next few business days, and maybe allow some things to open up with very soon.
Great. I'm seeing a few questions here in regards to washing comforters. Is there a spray or sanitizer to disinfect instead of washing?
I think Dr.
I think we've already said that we don't. That I just don't know.
Okay.
We're willing to look at things if there are if there are products that seem safe and effective. By all means, we're interested in finding ways to make this all work and stay safe.
Okay, let's go to one of the last. I see the last phone caller, Carla. Go ahead and unmute your line, and you can ask your question. Carla, if you're there, please hit *6 to unmute and ask your question. All right, doesn't seem to be working. We'll go back to the questions. These two draft items are not going to work together. Consider temporarily prohibiting customers from trying on clothing. Consider prohibiting product returns or exchanges. Any suggestions on those two items?
Yeah, good point. We'll take that back to the drawing board. And again, I mean, I think we need to take a closer look at the state retail, expectations, guidelines, standards, and try to reconcile what we've come up with the states.
Jeff, this is Ralph. Wondered if I could insert a quick question. Early in the call, county requests for variance on the state's guidelines and the idea of submitting an application if we meet guidelines, which are kind of unknown at this time. And my question is, how long will that take for approval? Is there a consensus amongst county executives, and who makes a decision about a request for variance? And is there a consensus among the callers on this call to try to go a little faster than the state guidelines? Also, for people, if there's a fishing opener on the 1st, would lodging allowances be made for the 31st of May for those that want to fish on the opener morning? So 2 questions, but that variance is the hotel variance or the county variance from the state requirements is kind of
Frank, do you want to take that? Frank, I tried to address that, but I perhaps wasn't clear enough. Frank, maybe you could take a shot at it.
All right, I'll attempt to, and Ralph, if I get off track, just jump in. I believe your question was related to the variance process. Is there consensus among the government and public health leaders to pursue this, and is there any way to go faster than we are now? Was that generally the question?
Yes, and who makes that decision? And is that the consensus of the community and of the callers?
Very good. So we do have the variance guidelines to the extent that there is actually a form. Dr. Booth filled that form out and submitted it. I think I saw it twice last night and again, maybe early this morning. The process is that you set up for a consultation call. That has been done. You submit an application. That has been done. Prior to that, unsolicited, before anybody asked for it, we went ahead and sent our position on our ability to move into stage 2 without anybody asking. So we certainly did that ahead of anybody, waiting for anything. Then for that to get approved, then if we met those conditions, which Dr. Boo's in discussions on that now, if that's met, there's a requirement to have concurrence between the public health officer who's present. He said that at this point, he would be willing to attest our ability to move through stage 2, but not stage 3. The governor doesn't allow us to go through to stage 3 just yet. It would also require approval from the hospital. We don't have a representative from the hospital here today, but I can tell you that in a meeting yesterday, Dr. Burrows, who sits daily with our Unified Command team, said that he would support that. And then it also requires the approval from the Board of Supervisors. And I don't have them here today, but I'm pretty confident based on the conversations we had earlier this week that they would support that. So that represents the kind of the process, who has the authorities, and to the best of my knowledge, their positions.
Thank you, Chief. It's Alicia Venice here. Just wanted to mention to the audience that the Board of Supervisors today is discussing some draft communication in response to this issue, and is also trying to look at it as potentially as a rural regional response. So that's at 1 o'clock today, Board of Supervisors meeting, and all are welcome.
So just to follow up again, Ralph, I mentioned earlier, I think of this in 3 lanes: the public health lane, the business reopening lane, and the political lane. And I can tell you that businesses directly, other than going through their associations, the governor's office, don't have direct route on this. But on the public health side, the EOC side, and on the political side, we're pushing this as fast and as far as we can. If we push any harder, it would mean that we would write orders for you to proceed that were ahead of the governor's orders. And we already have, at this point, 3 very clear actions that the governor's taken to pull those counties back. So I believe we're going absolutely as fast as we can at this point.
Great. Okay, we're at 10:26, so I think this will be the last question. We do have to move over to the Spanish meeting starting at 10:30. And just to reiterate Alicia's comment, the Mono County Board of Supervisors meeting at 1 p.m. can be viewed online at monocounty.ca.gov is the website. Okay, last question. Are we able to allow short-term rentals for people in the county? Examples: if someone from Mammoth wants to come camp in our boat in Bridgeport, is this allowed? If a resident in Bridgeport wants to ride local horseback, are they allowed?
So County Council has made it clear that when we're enforcing orders, well, first of all, there's nothing in the orders I'm aware of that allow a variance for locals only. In other words, you would treat one individual's access to services different than another person's access to services. Currently, the short-term rentals are not allowed, period, by the governor's order unless it's essential services, support for the homeless, support for quarantine or isolation, and we've made arrangements for those. So to the best of my knowledge, there's not within the current order room to treat the application of the order differently based on where you live. For people who have second homes, that's different because they own those, or if it was a long-term, housing situation.
Great, thank you, Chief Freevault. Again, we have 65 questions, but we'll have to end it there. We do need to transfer over to the Spanish meeting. I want to thank everyone for attending. If you still have additional questions, you can email us at covid19help@mono.ca.gov. And again, I'd encourage everyone to go onto the FAQ document that's been uploaded on the coronavirus portal, monohealth.com/coronavirus. Click on the business tab. A lot of the answers are within that document. And the draft guidelines are also uploaded to the same page. I want to thank everyone again. Have a great day, and we hope to talk with you soon. Thank you.